Hi, arthritis is a disease in which the joints become inflamed, causing pain, deformity, and difficulty in the movement. Although it can also affect other parts of the body, it is a chronic disease with a low frequency of spontaneous cure. Although with an adequate treatment, good control of the disease is achieved in most of the cases. The discomfort and limitation caused by this disease vary greatly from one patient to another, so that no two patients are the same. Rheumatoid arthritis is one of the more than 100 existing rheumatic diseases with a specific prognosis and treatment, so the diagnosis must be precise. Rheumatoid arthritis is frequent since our environment, 1 in 200 people. It is more frequent in women but affects also men. It is not a disease typical of advanced age, and although it can appear in an early age, it occurs more frequently between 45 and 55 years of age, and also a very similar form of arthritis can affect the children.
Rheumatoid arthritis occurs more frequently in people with a special predisposition. However, it is not a hereditary disease. The cause is unknown. Infectious agents like bacteria, viruses have been studied, and although suggestive data have been found in some cases. There is no evidence to confirm the involvement of one in particular. Rheumatoid arthritis is not contagious. So what is it? Rheumatoid arthritis is it known that there are alterations in the body immune of defense system. The inflammation that occurs in the joints is a consequence of the invasion of the synovial membrane. The ability to defend against infection is particularly normal in patients with rheumatoid arthritis. The weather and humidity have been nothing to do with the triggering or maintenance of rheumatoid arthritis. However, it is true that some climatic changes, and particularly when the weather is going to get worse, make any joint damage by this or another disease more painful.
The symptoms for this disease are that joint inflammation causes pain and swelling. Joint pain is the most common symptom in rheumatoid arthritis, and joint swelling may be more or less visible to the patient. Sometimes only the rheumatologist can detect this swelling by feeling the joints. The joints that are most frequently inflamed are the wrist, the knuckles, the finger, and the toe joints, the elbows, the shoulders, the hips, the knees, and the ankles. Neck pain can be also due to rheumatoid arthritis and should be reported to your doctor. In addition to pain and swelling, in the morning there may be difficulty in starting movements of variable duration, which can even last for hours.
To find out if a person has rheumatoid arthritis, the rheumatologist assesses the symptoms that have been previously indicated and performs an examination of the joints to check whether or not there are swelling. There are, however, many other rheumatic diseases that can cause similar discomfort. For this reason, the findings that can be found in X-rays and some analytical studies are very useful to confirm the diagnosis. It may happen that a person has pain and swelling in the joint for some time, and neither the severity of their symptoms nor the X-rays or tests allow the doctor to make a diagnosis of particular inflammatory rheumatic disease with certainty. Much of the advice in this brochure is also valid in these cases.
Now we are going to talk about the treatment. First, the diagnostic of rheumatoid arthritis changes the life of the person who suffers from it and for their family, who has to adjust sometimes important aspects of their daily activities to the new situation. You have to know that together with the rheumatologists, there is a group of professionals willing to help you. All of them usually have the experience of having helped hundreds or thousands of people with this disease.
The treatment of rheumatoid arthritis with drugs includes two groups of drugs. One of them includes those that serve to relieve pain and inflammation in the short term. They are useful for reducing inflammation and coping with day-to-day pain. But they don't serve to modify the course of disease in the long term. In this group are so-called non-steroidal and anti-inflammatory drugs and glucocorticoids.